Hello, my name is Daniel. I'm the co-founder of Medvit Health, where healthcare meets information technology. I'm a doctor, specialist in cardiology and kidney diseases, and a specialist in medical informatics. These are the points that I have to go through when I'm meeting a patient. Start by gathering some information and by doing a plan of treatment. Then the patient gives me some background information. It's like this. This is tedious to go through. Information overflow, limited time to double check things, worries of making mistakes, limited time for direct patient engagement. In the face of this information overflow, how do healthcare workers work? Well, they don't have time to analyze things in detail, so they grab to heuristics, which is a necessary tool everywhere, except it is fraught with cognitive biases. These cognitive biases can in turn lead to mistakes, and when the patient comes next time with this diagnosis, asks his doctor, maybe your gut feeling was indigestion after all. Medical mistakes, they are extremely common. Third leading cause of death, according to this study from Johns Hopkins. We all know headlines like these. In the case of high blood pressure, affects 20% of the world's population. 50 to 60% are not receiving adequate treatment, although they have a known diagnosis. Causes unnecessary strokes, heart attacks, and kidney failure, also in Iceland. There is an urgent need of providing healthcare by other means that increasing staff and demanding an increased throughput. Our value proposition, we take these moments, which I presented before, with our clinical data module, we make these more efficient. With our clinical reasoning module, there is our passion. We find treatment deviations from evidence-based practice guidelines and tackle these. Our value proposition with our solution is to lower these pain points, and we believe that the efficiency of a doctor's visit can be increased by up to 50%. This is my experience after 20 years working as a heart and kidney doctor. The increase in treatment quality will be calculated. We're going to give Dr. House a calculator. Our target customers, specialist physicians, general practitioners, nurses and healthcare professionals, because we believe in task shifting. We also have some next stage plans, patients, and healthcare administrators who follow quality in medicine. Milestones, we have had some grants, being quite lucky there. But we are especially proud that a separate solution is using our platform to build a dementia diagnosis module. We are implementing some solutions already in the next year, some basic parts of our software, and we are inviting investors to join after around 12 to 18 months. Our team specialized in diseases and their treatments. We have data scientists on board, software engineers, business analysts. So we have a complete team to tackle this problem and succeed. Thank you very much.
Thank you very much. I'm trying to get a better understanding of the actual product you deliver. Are you presenting a healthcare record system?
No. At the moment, it is a standalone side. We're not going to intrude into the healthcare workers' current workflow. We're going to put
a decision support system.
It's a decision support system.
Okay, so it's a regulated product.
Not our solution. In a way it is, but we are using sort of open, understandable methods to give these recommendations. We're not using a black box artificial intelligence, which is still under...
But your wish is to be able to tell doctors that woman has dementia.
Sorry?
Your wish is to be able to tell doctors that woman has dementia, or...
Well, in the case of dementia, that is a separate solution built on this. There we are, it's quite data intensive, where we are analyzing the sort of cognitive details with a lot of data points, and we are putting forth the likelihood of what type of dementia it is, which is becoming very important when the new treatments are coming for Alzheimer's and all the other diseases, which we can institute earlier today than previously.
What are the data sources? Does this extract the data from your patient records, et cetera, or do you have to input that data into the platform?
There is no manual input. We are gathering automatically from other sources. There is, many medical sources. Unfortunately, in Iceland, we have not come very far with standardizing our data sources. We have a standardized model built on international standards, FHIR, for example, but modified according to our research. And we have a transform module, which is transforming it to a data format which is easy to analyze and compare to sort of metadata on the best clinical practice guidelines.
Who is, one final question, who is the buyer? Who pays for the solution?
The healthcare industry is quite complex with a third-payer system. I'm in a unique position, working in the quality department at the Landspítali, so I have an intricate knowledge of this, oversee the database or quality databases there. I'm also working as a practitioner in Læknasetrið. There I can introduce it just to my friends in the next room.
Excellent.
You want to try?
We'll take it to the next room after everything. Thank you.